Hello, Gold viewers from around the world. Welcome to Gold Midwifery. I'm Kristen Schwartz, licensed midwife and MC here at Gold Midwifery. And here at Gold, we are getting ready for our Gold Midwifery Online Conference 2023. And it will be here before we know it, right? And today I have two special guests with me here. I have Marea Goodman and Rachlin here. Hello and welcome, the two of you.
Hi, thank you.
Hi, thanks for having us.
Lovely to have you here today. And you are starting out our conference interview sessions here. So this is very exciting. We do that for every conference. We do that so our viewers get to know our speakers here a little bit and also learn about the topic, get them excited about it. And because you do so much more than just giving presentations here at Gold, I want you to introduce yourself. First of all, let us know where in the world are you? And we're starting with Marea.
Okay, I live in Santa Cruz, California in the United States. I'm a licensed midwife and I specialize in working with the LGBTQ plus population. Ray and I also are co-authors of the upcoming book, Baby Making for Everybody, Fertility and Family Building for LGBTQ plus and solo parents. And that will be published in April.
Wow, that's exciting. Coming up next year. So brand new. I'm looking forward to this. And we'll talk about that a little bit more in just a moment. So Ray, on to you now.
Sure. I'm Ray Rachlin. My pronouns are they and she. I'm a certified professional midwife and licensed midwife in New Jersey. And I practice as a home birth midwife and do queer fertility care in kind of the greater Philadelphia area through my practice, Refuge Midwifery, and also co-author of this upcoming book on LGBTQ and solo parent family building, and excited to talk more about midwifery-led fertility care at the conference this winter.
Wonderful. Let me ask you this. How did the two of you get together? Because you're not in the same location and you're not in the same practice. So how did you come up and say, hey, let's do this book together?
Go ahead, Ray.
Yeah, well, we met on Instagram. So it feels like a very millennial midwife.
Yeah.
And I think we both have known about each other for a few years because there's only a handful of like out queer midwives in the home birth world. And we both started queer conception projects around the similar time. So I started a blog and Marea was starting an anthology project to like try and just bring queer conception stories to more of the forefront, and create like avenues for people to like learn about how other families have gotten pregnant and had babies. And then like once we realized we were doing similar projects, decided to join forces, and at some point realized like, oh, we're midwives. Like we help people get pregnant all the time. We probably should write a little bit about that. And somehow an anthology project with writing a little bit about how to create a pregnancy turned into a full-blown instructional book on how we create families. And yeah, like 2 years in, it's pretty incredible and almost about to be born into the world.
Absolutely wonderful. I love that. I absolutely love that. Thank you so much for sharing that here with us. And I have to tell you, we chatted a little bit before went on camera here together. I'm a licensed midwife practicing in Florida. And I know from my colleagues here, as well as from others in the United States and all around the world, we get, there's, families coming to us with questions regarding fertility and what they can do. And I have to tell you, I need this education, right? I don't feel educated enough to really give sound advice or even, facilitate as such, because, also a little bit here in the state of Florida, we're a little limited in what midwives can or licensed midwives, home birth midwives can and cannot do. And it's like a little bit of a gray zone, at least for me, knowledge-wise as well. So I'm super excited that you are here presenting on this, sharing the information, sharing the knowledge, which is so super important because, everybody should create the family they want, and midwives need to have that education to help and assist these families. So tell us a little bit about the presentation. We only have an hour, and you can only put so much in this hour together there at the Gold Midwifery Conference, and that's why you also have that book. And do I believe you also have a program or course, or you're teaching other midwives or to learn more?
Yeah, in about, I think it's going to be out in fall 2023, but we're working on teaching midwives how to provide IUI, intrauterine inseminations. So that's exciting, and we can talk
Yes.
about that after the presentation for people who are interested. But just back to what you said, Kristen,
Yes.
yeah, like this is not usually a part of general training for becoming midwives. And I think the midwifery model of care applies so beautifully to fertility care because it's about a person-centered approach, empowering people with the information that they need and deserve about their bodies, how their bodies work, all of their options, and being able to support somebody through that family building process in a way that feels aligned with their values. And I think midwives are so usually, so good at that empowerment piece. And so it fits really well together. So in the presentation, we're going to talk about just how to support people to understand their fertility, supporting folks through choosing a sperm donor, the logistics of ordering sperm from a sperm bank, their different insemination options, how to support them to track and time inseminations. And then we're going to talk a lot about special considerations for working with queer and trans people and making sure that we're supporting folks in ways that they need, that are culturally appropriate with them. Yeah, want to add anything, Ray, to that?
No, I think you covered it really well. I think we're doing the 101 on this is what midwifery fertility care looks like, and this is how to be an affirming provider, and just kind of create a jumping off point for folks who are wanting to include fertility care in their practice to start being able to learn more and become inclusive providers.
Sounds fabulous. Inclusive providers. I absolutely love that. And I feel like, you know what, when I heard you talking there and I'm thinking you know what, this should be taught at midwifery school, right? We should have that included in, and I don't know if there's probably some schools out there already who are including this into their teachings. It certainly wasn't taught when I was, it's been a while that I went back to, was at school. But have you seen anything that this is being, I don't know, are you working with any midwifery schools or programs out there advising, and maybe that this is part of standard midwifery, learning and education?
Yeah, I'm affiliated with the National Midwifery Institute, and I know that they're working on, especially focusing on offering information to support people to be inclusive providers and some basic knowledge around fertility care. I think, it's interesting in the US because the laws in each state differ about the scope of practice, but I do think that insemination support is often a gray area, and it's more and more people, heterosexual people included, are needing some fertility support. And so I agree, it would be wonderful to have this be part of the whole midwifery education package, and hopefully in the next 5 years we'll see that start to change.
Beautiful. Can't wait. I can't wait for the presentation you will have here with us at GOLD, here at the GOLD Midwifery Online Conference 2023. It was such a pleasure talking with both of you, Marea and Ray. Thank you so much for joining us here today. And any last words from both of you? Ray, anything you would like to add before we let you go?
I was thinking about your last question, and, when we were midwifery students and as new midwives, had to do a lot of work to try and get this education because, the systems are not designed around the needs of queer families, single parent families.
Right.
And now I think there's a growing awareness that this care is wanted and desired. And I'm excited to just kind of be a part of this next step of making family building and non-traditional family building a part of mainstay education.
Fantastic. Absolutely good. And Marea.
Well, I just want to shout out my wife, who's also a midwife. Her name's Andrea Ruizquez, and she actually was the person who originally taught me how to do IUIs and basic fertility care. And it's I think what's beautiful about midwifery is we use the apprenticeship model and teach people. And so I'm hoping that, Ray and I can keep sharing that knowledge that we've learned from other midwives and different people. Our clients teach us so much around their experiences and our own personal experiences of building queer family as well. So we're excited to be part of this conference.
Very exciting. Thank you both so very much. And now just some information for our viewers. If you are curious now and want to learn more about this fantastic presentation here at GOLD and the other presentations in the series of the GOLD Midwifery Conference, I would like to invite you to visit goldmidwifery.com. Thank you, everyone. And thank you again, Marea and Ray, for chatting with me here today. Bye-bye, everyone.